Hi, this is Dr. Tom Rogers coming to you today with the weekly podcast that I call the Common Sense MD. Of course, I have Andy Rogers here today, special guest, head PA and also son. Great to have you.
Here on Father's Day. Happy Father's
That's
Day.
right.
Today we're filming on Father's Day.
That's
yes.
right. We're going to have a
Appreciating
great
all you fathers out there.
We're going to have a great podcast today. Andy and I just got back last night from a great integrative medical conference in North Carolina. So what I thought today, usually my podcasts dive in on one subject. Today, I'm going to hit pearls from our conference, and I'm going to give my little, what I learned from it, and then you can talk about what you learned from it, and then we can sum it up. But it was a great conference. As you know, we go to a lot of meetings all over the country and of like-minded practitioners, and it was just comforting, really, to know we're practicing the right way. And I always learn new stuff, and I always talk to a lot of other providers, and it's really reassuring that we're doing the right thing. So in any event, so we'll start out with some pearls. You know, one thing I always do when I go to these things, I always learn something new. And this time I learned more than one thing new. How about you?
I did too, yeah. There was some, one particularly on the hormone replacement therapy kind of reiterated what we were doing, especially within the hormone replacement therapy and kind of the dispelling some myths, common myths. I thought that one was a little bit more review, but also very helpful. And then some new stuff, especially about nutrition.
Oh, just
nutrition and Lyme disease.
And Lyme, and it's just amazing, that guy, Dr. Horowitz from New York. But in any event, really in today's corporate medical world that's run by bureaucrats that don't practice medicine, or even doctors that do practice medicine, it's usually cookbook, out of date, defensive medicine. And that's what's so reassuring when you go to one of these and you have people that actually practice like you should practice, because they're free to do so. And the only reason we can do that really is because our format.
Exactly.
And that's the only reason I still practice medicine. I mean, if I didn't practice medicine, I would still learn this stuff for myself, because
Right.
I'm almost 70 years old. I want to know this stuff for my own benefit, but it's nice when you can practice medicine like I do and you do, and pass it on to other people, because they're not getting it. I mean, most doctors and providers, they just don't get it.
And also, I think it's important, too, to go to a practitioner that's also interested in their own health. Everyone there, we looked around, and we got to Jill from our Bristol office and Amber from our Kingsport office also came with us. So we have practitioners that are interested in doing it not only for them, but for their family members and for their patients, too. You see everyone practicing what they preach.
You do, and I'm like you. I'm thinking what you're thinking. I did not see any fat people there. I didn't see one.
Everyone was of healthy weight.
Yeah,
and also interested in what they were doing, because they had anecdotes from their own lives.
Exactly right. So when you have to practice that type of corporate medicine, guess who loses? The patient. And so we are patient focused. But anyway, here's some of my pearls. Did you know that we're talking about ultra processed foods? 60% of adult diets in the United States are ultra processed foods. Mm-hmm. 70% of kids' diets are ultra-processed foods. And that's sad. No wonder we're seeing sick adults and fat kids. We just
absolutely.
Call it like it is. As you can see, I took notes from my conference, which I always do. Really, they emphasize, too, on nutrition. Over the past several decades, the nutrients in our soil has depleted by over 50%, meaning there's less diversity in our gut microbiome. 75% of the world's food comes from 12 plants and 5 animals.
I thought that was astounding. I really did. I thought it'd be a little bit more diverse than that. It is very limited what we eat.
We need more diversity in our diets, so our gut microbiome will be more diverse, because that's what's healthy for you. Remember, these bacteria in your gut comprise 99% of the DNA in your body. And it regulates your immune systems, tells your brain how to function. Think about your vagus nerve that we talked about a lot. That big, huge nerve in your body that connects your gut to your brain, and how important it is for your health. Remember your vagal tone, which means your parasympathetic nervous system, what regulates how relaxed you are, your breathing, things you don't even think about. That's very, very important to have a really good parasympathetic nervous system because it's important to your well-being. That's why stress and cortisol can wreak havoc on not only your gut but your brain, because those bacteria in your gut tell your brain how to function. So we talked a lot about SIBO, small intestinal bacterial overgrowth, speaking of nutrition. And the thing I got out of those lectures on that was that there's a consensus that no SIBO diet actually works. Now that was,
and she's a SIBO expert. So the practitioner that gave that lecture particularly is considered an expert. She has 10 years of experience in SIBO and just with SIBO, with nutritional interventions. And she's like, disclaimer, no SIBO diet really works.
Yeah, the low FODMAP.
Everything was evidence-based, which I loved.
Yeah, it was a really good talk. She emphasized that really the thing we need to worry about more than SIBO and a particular diet, that because everybody's different with diets, everybody responds better to a certain diet, whether you're plant-based or carnivore, keto, whatever, people are different, and you should be able to use diversity with your diets because people think a lot differently, they metabolize differently. But in any event, her point was really it's more important to enjoy good food and connect with other people for good vagal tone. So relax, eat with other people, chew slowly, and really try to eat at the same time every day if you can.
I did like that. So her analogy with that was actually with almost like a person that clocks in at work, like a factory worker. So the factory worker that clocks in at 9 o'clock, reliable, always there, and has 2 tasks before lunch, clocks out, comes back in, has 2 tasks before dinner. You're going to get really good results out of that employee. If the employee ends up coming in at 11 or 7 or 12 and has 500 tasks, they're not going to complete the work that they need to. So that's like your gut. You want to be a little bit more rhythmic with your gut. Allow your gut to have a few things at a time and chew slowly. My granddad on mom's side chewed so slowly. It would take him hours to finish dinner, and I thought it was really annoying. But now I'm thinking that's maybe not that slowly, but to chew. Sure. He did. To chew more slowly, to take your time, and also you feel fuller faster.
This kind of relates to my next pearl, which you can certainly relate to being a type 1 diabetic, but we talked a lot about insulin resistance. Mm-hmm. And that's something we always try to recognize early and treat early. That's very important. Those insulin resistance numbers that we do on our Cleveland panel are so important. But a couple pearls for you. If your hemoglobin A1C is 5.5 or greater, you're getting insulin resistant. As a matter of fact, if you're at 5.6, you're already getting vascular damage. So that's very important. The other thing that's important is that total cholesterol to HDL ratio. Mm-hmm. Your waist circumference is important. We talk about the ApoB and everything else. So I love our Cleveland panel. I mean, it really can recognize early when you're going to have a problem, and that's what we're looking at is prevention. But another pearl that I got, and I'm sure you did this too because everybody was looking at this and thinking about it, you can stimulate the good release of insulin with amino acids before you eat. So their suggestion was eating 15 grams of whey protein once or twice a day pre-meal. It really blunts the spikes of your blood sugar.
Right. And thinking that's a base. So too, when you're doing base before, something basic is going to stimulate. It almost smooths things out. I thought that was wild.
That was a great
15 grams of whey protein in water. Yep. Before your 2 largest meals or at least once.
Yeah, and it probably prevents you from overeating. And we had another practitioner that said apple cider vinegar would do the same thing, which I've heard before.
Right. She also made a big claim about how much weight loss was with apple cider vinegar. But I do think that apple cider vinegar is great for the gut anyway.
It really is. It's good to have. Water it down. Don't take it straight. It's too harsh. Vitamin D prevents insulin resistance, and berberine that we talk about all the time. It's great for insulin resistance. It really works.
And I asked her individually with this particular provider about dihydroberberine versus actual berberine. She said there's not a ton of studies on dihydroberberine specifically, but both work well and can be interchangeable. We talked a lot about dosing. She actually likes to add berberine, and there's a lot of evidence-based medicine on adding berberine to medicine.
Yeah. So whether it be your metformin or your semaglutide or whatever, but yeah, it's safe to do. Watch your blood sugar, says they will drop with berberine. It actually works. I think as good as metformin with way less GI side effects or other side effects.
And there's other properties in there too that help out with your adrenals.
Yeah, exactly right. Plus it lowers your cholesterol, lowers your blood pressure.
Yes, there's a lot more to berberine than just insulin and glucose.
We get great results with it. We talked a lot about hormone myths, like you mentioned. Bioidentical hormone replacement does not cause breast cancer, or in fact, it doesn't cause any cancers. It actually decreases your risk. Look at the recent study on women over 65 using bioidentical hormones. Way less all-cause mortality from less AFib, less DVT, less heart failure, less heart attacks, less Alzheimer's, less osteoporosis. Really, if you in the hands of somebody that knows what they're doing, and certainly you need to know the right forms, you need to know how to do this. And we've been doing it for so many years. We know how to do it. But it's so important for these women. There's a whole generation of women that are missing out. They're getting old before they really have to.
And two, even though you're not introducing a hormone that could potentially make something in the breast tissue grow, you're really missing out on everything else, especially too with cognitive function and Alzheimer's prevention. I thought we had several practitioners that didn't even ask questions, that just came and wanted to say, by the way, it really does innervate receptors in your brain. So you're missing out, even if providers got scared. Yeah. They got scared because of that one study, and then everybody that did the Women's Health Initiative, when they reevaluated it later, they had a lot of different things to say about what happened.
Yeah, we talked a lot about the WHI study back in 2002. A lot of bogus material from that, so it's really shameful.
And also on that, the importance of estriol and intravaginal estrogen. There's a lot more that we can play around with that particular hormone, even with women who have had breast cancer.
Exactly right, which we do all the time. Testosterone prevents heart disease. Doesn't cause it, and it prevents prostate disease. It does not cause prostate cancer or prostatic enlargement. In fact, it helps prevent them, which is, again, you have to know what you're doing. You have to look at, is it aromatizing to estradiol? Is it popping up your hematocrit? But if you know what you're doing, it's totally not only safe, but preventative as well.
And can be tailored. Everyone responds to these hormones very differently. And I've seen that too clinically, but she also, the practitioner that gave this lecture was really, really adamant that it has to be tailored. She did mention too, so when you're looking at SEMA, I think the language and the verbiage that's used with this, gynecologists and some of the people that are on more the traditional side won't say bioidentical. They won't say compounded interventions. So they still don't use those words because they don't want to put credit into it, but that's what we use. We use compounded medications to tailor medications, and bioidentical because they don't really understand it or don't really want to put weight right behind it in the traditional setting. But that's what it is.
Yeah. Plus a lot of them practice defensively. They really
Right.
just lose a lot of the empathy because they know that their group doesn't want him doing this, or they're worried about their boards or whatever, but it's just a lot of misinformation. That's where the misinformation is coming from, really.
Absolutely.
Not from the integrative side. But we talked a lot about mast cell activation syndrome, which I'm going to do a podcast on. We talked a lot about oxalates, which I'll podcast on. We talked about Lyme disease and the related diseases that are like Lyme, like Bartonella, which is worse than Lyme, and how it may even contribute to Alzheimer's disease. I mean, what if Alzheimer's disease, out of the many things that contribute to the cause of Alzheimer's, it's multiple factors, it's not one, but what if it was caused by infection?
He made a really solid point that it could. And two, even when he was intervening and getting rid of these chronic Lyme symptoms, we're going to come up with a really good protocol. We're going to come up with a protocol based on and this is going to be a future podcast, on chronic Lyme disease and the use of dapsone.
Yeah.
I thought the use of dapsone, especially too with Alzheimer's.
Dapsone's a medicine that we used to treat leprosy or Hansen's disease, same thing, and a couple other indications. But again, I love these repurposed drugs that they're finding out can have
great.
just like that huge study of hundreds of thousands of men that showed that they took Viagra on a regular basis, they're 60% less likely to get dementia because of circulation. So a lot of these things that are cool that you don't even think about that could really help you. It's amazing that some of these repurposed drugs are way better than these new drugs they're thinking of that cost billions of dollars that nobody could afford anyway, like these new Alzheimer's drugs that don't work very much, could cause your brain to bleed and cost you thousands and thousands of dollars, every month. So, why not use something that's way safer, probably works a lot better, and makes more sense to use. So, so it's just comforting to know. Also they talked a lot about methylene blue and LDN, something that we use all the time. How many times was that mentioned?
Every lecture mentioned LDN. That was fun. I was like, every lecture mentioned low dose naltrexone. Oh, for mast cell activation, did you know LDN could be good? Oh, for Lyme disease, did you know that LDN could be good? Oh, did you know for high oxalate diet that LDN can actually help you get off of it? Did you know that LDN's the bomb? If you've been in the room with me, I will sing from the rooftops. LDN and methylene blue. Nearly every patient can be doing that.
Yeah, they could.
And Dr. Horowitz, who did the Lyme disease discussion, uses high doses, much higher than what I learned from the Dr. Schur lectures. It's very interesting because anytime I hear that, it's always really nice to hear as a practitioner to be like, oh, you're using it at doses of 300 milligrams, high doses that we could actually kind of beef up our doses a little bit. His particular Alzheimer's prevention dose is around 25 milligrams twice a day, 50 milligrams.
Yep. And remember, he sees the worst of the worst.
Anybody
that has Lyme goes up to New York to get treatment by him. So he kind of wrote the book on it. But it was really interesting.
Our threshold it's just fun to see what other practitioners are doing and to learn best practices from other people and kind of expand our knowledge.
Yeah. Well, I had a great time at the conference.
Awesome.
Any other pearls that you got that you want to mention?
I kind of gave my 2 cents on different ones. I really liked the SIBO one. I really, really liked the SIBO one, and I thought she was really great. She has a social media that we can share too that kind of gives best practices. She was not big on FODMAP, or she was big on FODMAP for a very short period of time, 2 weeks top. I think it was 2 to 4 weeks tops. Not even 6. I think it was 2 weeks tops.
The thing about some of these diets that people get on, they just can't sustain them for very long.
Well, and I liked what she's saying. It was restrictive. That she actually had people that she said that she deals with people who have medical PTSD. That I don't know what's wrong with me. I've had thousands of dollars of tests, and then we end up getting a lot of people like that.
We do.
She was big on stagnation. So she says she had 2 bodies of water, a running river and a cesspool that just sat there. You'll want your stuff to move. So she was big on motility as well. Yeah. She gave best practices too that can give those.
You're toxic, in other words.
That is your detox system. She gave 3 of Prokinetics, Integrative Therapeutics, their motility activator, their Apex Energetics acetylcholine activator, were 2 that she really liked for pro-motility. So too, you want to be moving. You want your bowels to be moving. If you're not moving, you're not detoxing.
That's right. If you're not moving, you're not sweating, you're not urinating,
you're not detoxing.
You're not breathing properly, then you're not detoxing. We did a lot of breath work at that conference.
We did breath work. Dad did some yoga work at the table, which was hilarious. But you did great. You did great. He's very graceful.
Thank you, Andy.
But I thought hers is really great. 2 of the things, Dr.
Patrick Hanaway.
So you've taken classes from him. He's a big gut guy. He's also spent time out in Native American cultures. Someone came up and asked a question that was very kind of like, we need to be more active and get angry. I'm angry about that kids aren't getting good foods. And I thought his answer was amazing, that activism and anger don't really get you places. They really
Yeah,
don't. And
that's
two,
just such a great
how
answer.
much activism is out there right now? Now, two, there can be movements that can help change legislation, especially with the foods that kids get in school. But he thought going individually and working people more on a gratitude or a grateful level was really great. He had a great answer about anger. And another one too is, I think the provider that was talking about mast cell activation, he said, don't poke the skunk.
Yeah, that was a great statement. Like, say you have MCAS, mast cell problems, and then you start digging, well, do you have Lyme too? Or do you have this and that too? If you're getting better through your therapies for MCAS, then don't poke the skunk and try going down a road you don't.
Hole.
Yeah, down a rabbit hole to where I see a lot of patients like that. They're so over focused on the testing, too many tests that
my
they never
SIBO's
get
ruined my
anywhere.
life. This is ruining my life. I was like, well, the more we say it, the more it probably is. Or I say, what exactly do I need to be on? Okay, well, I need to be on pro-resolving mediators. I need to be on. I was like, well, do you feel good? It's like, if you feel pretty good and you're sleeping well and you're having normal bowel movements, let's not poke the skunk. I'm going to start saying that a lot more in the room.
Did you know that simply having a positive outlook in life adds 7.5 years to your life?
It's amazing. I did not know that statistic, but I absolutely believe it. I'm a big, especially too, with the way that we connect spiritually, the way that we kind of connect outside of ourselves. The I am statements are really big. The more you say, I am fat, I am tired, I am this, I am in pain, the more you're going to be in it.
That's exactly right.
I am ugly. I cannot tell you how many people come in and just say, I am a piece of whatever.
Yeah.
Then you probably are. You got to stop putting that out into the universe. I think, too, it'll add years to your life, and you'll be so much more joyful and grateful to offer gratitude. And especially this generation, I don't feel that I think we need to make a change with offering more gratitude, especially coming into an election year.
I agree with you.
It's gonna get
I'm reading the story about the founder of Whole Foods right now. And,
right.
He did it based on eating clean, good foods. It's ironic when his company got really big, the activists started coming after him, even though he was huge on organic and greatly sourced foods, even when it was animals and stuff. And, he got the most heat for it because he was more visible. When all the other ones, they didn't want to come after them. They came after Whole Foods, which is probably, at the time, and probably still is, one of the most organic, sourced grocery stores in the world. So it's just ironic. But you're right. Too much anger and not enough love, not enough gratitude. If you practice gratitude, your whole life will go better. But we're digressing.
No, I think that's great. That's what I learned so much from this. And to close out, I feel grateful that performance medicine exists. I feel grateful that we have really great providers, front and back staff members. I feel grateful for you as my dad too, that I've gotten to be in this company, and that I get to start a little bit earlier too in a health journey for longevity.
I wish I'd known this stuff 40 years ago when I started practicing.
This is very synergistic. That was the title of it. Synergy. So two, we'll have really specific podcasts more on mast cell activation, on Lyme disease, DAP zone, some of that. But taking away these pearls too, if anything, feel grateful and eat more slowly, take life a little bit more slowly.
Yeah. Well, listen, this has been great, Andy. Thank you so much for coming on Father's Day. We'll see you guys next week.